My name is Glenn Goltz. I first heard about Restore Health when I was referred directly by my primary care physician, Dr. Brian Lenskis. My urgent goal was to begin losing weight to correct my obesity, and then also to correct as quickly as I could the lab studies that were pushing me toward insulin resistance.
My name's Pamela, and I heard about Restore Health from Pam Devine and Doug Reynolds. I've been active in the low-carb San Diego community for a while, and they brought up the fact that Restore Health was a program they wanted to use. I wanted to see if I could make some changes that I need. I live pretty much a low-carb life and lifestyle, but there were some changes that I wanted to make in my health, mainly poor sleeping habits for years and years and years.
Hi, my name is Terry Smith-Wright. I was interested in trying Restore Health when I read about the multiple levels that they address. It's more than just what foods to eat. I did do a low carb program, but it was more of a low carb and lean, all lean protein. And while I was successful at weight loss, I was hungry all the time and it just didn't stick. There were things that got in the way, like stress eating or not sleeping. I couldn't get there. And when I read about this program, I thought it's the program that may be able to help me get there and flip those switches.